Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to the team members at the Tennessee Department of Health. We communicate with these folks daily, on a daily basis, and are grateful for their willingness to answer questions, provide guidance, and listen to our feedback. Their commitment to being a resource for local and regional jurisdictions is something that we are thankful for daily. We are also grateful for the work that the East Tennessee Regional Health Office is doing for our surrounding counties. Your work and partnership is extremely appreciated by all of us here at Knox County Health Department. Before we dive into the benchmarks, I want to reiterate some of what we spoke about on Tuesday. Because of the new prioritization measures we announced related to case investigations and contact tracing, not all cases will get a call from the health department. What this means is that anyone who receives a positive test result should immediately isolate and notify their close contacts of the need to quarantine. Medical providers, especially all of you that are providing testing in our community, please assist us in communicating this message to your patients. You can point them to our webpage where we have isolation and quarantine guidance, as well as a calculator that can be used to determine a person's isolation and quarantine time period. It can be found at covid.knoxcountytn.gov/prevention-and-support. Employers, this message is also extremely important for you to hear too. Because of these changes, we will no longer be able to provide return to work letters for everyone. So please help supplement the contact tracing process by conducting it within your organization. It's extremely important that individuals take personal responsibility and employers use their standard infection control procedures to implement proper safety precautions, similar to how you do with other illnesses in the workplace all the time. Please take the initiative and follow these steps to ensure you are keeping those around you safe and healthy. We'll now move into the local situation. We have 383 new confirmed cases since yesterday's report, giving us 21,898 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 1,327 probable cases. 20,187 of our cases are considered inactive, giving us 2,835 active cases. 649 individuals have been hospitalized at some point in their illness, and we currently have 146 Knox County residents hospitalized. Sadly, we have 8 additional deaths to report today, raising our total to 203. And now we'll turn to the benchmarks. All of this data that we're going to talk about is on our website. Again, you can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark.
We'll work to bring up those benchmarks in just a second.
So do I keep talking or do I
keep talking?
Okay.
We'll bring them up.
Sustained reduction or stability of new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and growth rate over time. Over this time period, we again hit a new record high in case volume. There were 9 red flags detected, of which there were consecutive day trends, We saw an average of 320 new cases per day over the past 7 days, and that is up from an average of 281 cases per day over the past 14 days. Because of these factors, we are continuing to represent this benchmark as red.
All right. Now you should be able to see the benchmarks on your screen, everybody.
All right, so we're gonna scroll down. We did the first one, it's red. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we're utilizing 2 bar graphs. One that shows a sample of tests conducted for Knox County residents and another for average time between specimen collection and lab report data. Regarding testing, the total number of tests conducted has increased over recent weeks, and this is good. During this time period, we saw the most tests per week since the reporting began. However, the issue that we are continuing to see is with lab turnaround time. Over this time period, we saw 5 red flags and 2 yellow flags, all on consecutive days. Lab turnaround time in our community has increased since the beginning of September and is on average now between 6 and 7 days for this time period. Of note, some of the issues we're seeing with this, it's both lab processing and turnaround time, but also the reporting time and the state reporting systems kind of combined together, and where we're seeing these 6 to 7 days average. Because of these factors, we are representing this benchmark as red. Our third benchmark, sustained or increased public health capability. Of the cases that fall within new prioritization structure we spoke about on Tuesday, the goal remains to initiate investigations for new cases within 24 hours of notification and initiate close contact investigations within 48 hours of investigation. Based on our internal assessment of our capabilities and acknowledging the need to prioritize our case investigations and contact tracing, we are representing this benchmark as red again this week. We want to again remind everyone, we can't say this enough, to please take personal responsibility and quarantine yourselves at the first sign of exposure. Please do not wait for a call from public health to start taking action. Isolate yourself away from others if you have symptoms or have been exposed, and start calling your close contacts to make them aware so they can begin quarantining. Additionally, if you've been tested, regardless of whether or not you have symptoms, you need to quarantine until you get the test results. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. These data are gathered from information the hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. During this time period, there were 5 red flags and 6 yellow flags detected for the number of inpatients with COVID-19, of which there were consecutive day trends. Additionally, there were 8 red flags detected for COVID-19 patients in the ICU, 7 of which occurred on consecutive days. 12 red flags were detected for the number of COVID-19 patients on ventilators, 11 of which were on consecutive days. And after speaking with our hospital partners, they have recommended that this benchmark be represented as red again this week. As always, the hospital systems continue to meet routinely, work together to ensure that no system is impacted disproportionately, and plan their response together to best serve the community. And the decisions regarding how to classify this benchmark are made in concert with those hospital partners, as well as taking all of the data into consideration. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. We have seen 15 deaths to COVID-19 over the past 7 days, and this would have been pulled previous to today, and 33 deaths in the last 14 days. This information available leads us to represent this benchmark as red. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, the 14-day trend line shows 63 new cases per 100,000, and our 7-day trend line shows 66 new cases per 100,000, both of which are up from last week. And the second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health, and the 7-day average for percent positive in Knox County is 22.67%, which is up from last week as well. And now I'll open it up for questions.
All right, please go ahead and submit your questions into the chat feature. The first question we have is from Katie with WBIR. Knox County reports 8 deaths today and another hospitalization record. Is this the Thanksgiving surge, and what does this say about Christmas?
It's concerning. It's very, very concerning. We are actually probably seeing mostly the test results being from Thanksgiving surge. We might see some hospitalizations and death, but typically those lag a little bit further behind. Typically testing comes in about 10 to 14 days after that holiday. But really, the message that we want to get across and what that says about Christmas and the whole season in front of us is that we, again, cannot say this enough, really want you to rethink how you socialize. We still want you to connect, but not to do it physically within 6 feet of people. This is very important because you need to consider that anybody you're in contact with at this point in time could be potentially infectious, or you could be potentially infectious and you don't know it and can be spreading it to others. So please think about how you're socializing over the holidays. Really think about whether you need to attend the events and continue to follow the 5 core actions that we've been talking about this whole time.
From Jeff with WATE, can you tell us any demographic details about the 8 deaths reported today?
We can give you the broad age categories that we've done. I don't have them in front of me, but we'll follow up with that. But that's as far as we can go.
All right, any further questions, please go ahead and submit them now. Also from Jeff with WATE, can you tell yet what fraction of the overall cases will be able to be contacted by KCHD under the new prioritization structure? I ask because the average test return time is now almost 7 days, and that's outside of the priority window. So can you say yet that the average case won't get a call?
I can't really say yet. We just talked about this and implemented it on Tuesday. So we'll give you a little, we need to look at it a little bit more and see where we go. But that is an average time. So we still do get a lot of cases in that are under that window as well that we can follow up on. But yeah, give us a little bit more time to have a better idea of what it's going to look like, given all of the different constraints and parameters that are out there with lab reporting and the state reporting system and all of those things.
From Katie with WBIR, this is a follow-up to her previous holiday question. Is it safe to go to a Christmas parade? What would you encourage the public to do instead?
I would encourage you to watch it on TV instead, and really, again, follow those 5 core actions, making sure that you're able, if you're going to attend, you need to keep at least 6 feet away from you and your household members in these events, whatever you're doing. That's the biggest key there. And also encouraging people to wear masks and not go if they're sick, and all of the rest of the 5 core actions that are out there. But again, we're really asking people to take that personal responsibility and think about what activities they have to do during this time and which ones they can do in a different way.
Also from David with WVLT, what is the number of vaccines Knox County is expecting next week?
So that number changes every single day. So we still don't feel good about putting it out. We are working every day with the State Department of Health, and our Dina Mashburn, our Director of Nursing. You're going to start seeing more of her in these briefings to be able to provide updates. But literally the number changed this morning from what we heard yesterday. So as soon as we can put some consistent information, and we're receiving consistent information, we'll put it out there. But we do still expect to start receiving it next week. That's remained, or not next week, the 20 week. Before the end of the year. There we go.
From Jeff with WATE, can you tell us what the vaccine distribution process will look like on day/week 1? We know it will start with healthcare workers, but will the shots go straight to the hospital, to the health department?
Yeah, again, I think the best place to do this is to look at the Tennessee Department of Health's plan on the state website. And I think Kelsey can follow up with where that is. There's a draft plan that's out there. Oh, it's on our website.
Yes, we put it on our website as well. We've got a vaccine section of our website, and that's where you can see the Tennessee Department of Health's plan.
But to briefly answer your question, the first round of vaccines will go directly to our hospital partners. And then from there, they'll go out to public health and some other hospitals who didn't get it in the first round.
From Katie with WBIR, do hospitals have specific dates to get the vaccine?
They do not yet. They've received tentative dates as well, but all of us, I think that we've been told that we will know for 100% certain the day before we get it. But other than that, we're kind of given planning timeframes, which have been discussed publicly already.
Any further questions, please go ahead and submit them. From Claire with WUOT, the latest White House report says vaccination likely won't have an impact on case numbers until late spring. Is the health department operating under the same assumption? We absolutely are, and we absolutely will be continuing to encourage everybody to stay vigilant and follow all the guidelines on protecting each other through that period. So basically what we'll be getting is small amounts over several months, and getting those out as fast as we can. And until there is a whole lot of vaccine in arms throughout the community, we really cannot let off on the gas on trying to do all the things we can to prevent the spread in other ways. From Katie with WBIR, what will transportation and logistics process of getting the vaccine to Knoxville look like, and where will the vaccine be stored?
There are so many details to that, and it's dependent on the vaccine that's coming, but there are some details of that I would reference the state plan for you to look at that has the kind of general guidelines, but it is different for the different vaccines and way too many details for me to try to go into here.
Any further questions, please go ahead and submit them. Also from Katie with WBIR, were you involved in this decision for Knox County schools to go virtual?
They made that operational decision, and we always support that based on what they were seeing within the schools and their capability to keep things going there. And so we talk to them still every day, but that was an operational decision that they made.
From Vincent with the Sentinel, the Tennessee Department of Health's plan is capable of vaccinating 12% of the highest priority population initially. This is a pretty low number in terms of overall population. Typical vaccines require about 70% vaccination rate to be effective across a community. Do you have any comment on this?
Yeah, I mean, this is going to be a massive undertaking and a massive process that we're going to be working through. But I think those initial planning numbers are based on the amount of vaccine that we're expecting to get that we can distribute as well. And so we're going to be doing a whole lot over the next few months and getting it out as quick as we can as soon as we receive it. But there's still so many logistics outside of our realm that go along with that. That need to be understood and acknowledged from everybody out there, that there's a lot more to go with that, and all of the partners that are involved as well. They'll be getting it out as quick as they can also.
From Brian Hornback, only 2 of 9 Knox school board members support meeting as a board virtually. What is your recommendation on that?
We always consider and recommend that folks follow the Board of Health's recommendations on that. And it's really when you can meet virtually that you meet virtually. It's really the safest thing to do in this environment, given all of the amount of disease burden that we have. I just said we should believe or act as if anybody that we're coming in contact with is potentially a case, or that you're potentially a case. And so when we need to limit the amount of interactions we have with people as much as possible.
From David with WVLT, what was the number as of this morning that Knox County is expecting on vaccinations?
I don't have that in front of me, and I don't know if Dina, I just know the number changed. So we'll have to, it's not helpful at this point, because if it goes from, a huge number to a small number or back or forth, it can cause a lot of confusion. So again, we are telling you, we will provide the number when we feel comfortable and confident that the number is close to what we'll have.
From Jeff with WATE, will the media have access to the initial delivery / administration of the first vaccines? Obviously, we want that. If not you, to whom do we make our plea?
Oh, so like media availability to see people getting it?
Yes.
Those will be going to the hospitals. So I would reach out to them to see about that. I don't know what the take will be, but as I said, the initial vaccines are going to the hospitals.
Any further questions, please go ahead and submit them now. From Claire with WUOT, Anderson County Health Department is reporting much faster testing turnaround times. Why is there a large disparity between neighboring counties?
I can't say. I don't know what's happening in Anderson County. I can tell you that our test results are coming back faster than the average right now. There's so many different labs that are doing work and have different turnaround times. They have different processing capabilities that change based on how many people are going to them, plus their logistical challenges sometimes. So there's the lab piece, there's the getting the records into the reporting system so that we can act on them piece, and there's challenges with that reporting system that is being overwhelmed. We've talked about that a lot. And all of the different things that go into all of those things can impact numbers. So ask the labs, ask Anderson County or the East Tennessee Regional Health Office if you'd like. But what we're reporting today is what our average was last week.
All right, any further questions? From Jeff with WATE, I don't see many Knox County specifics in the state's draft vaccine plan. For example, how many cold freezers does KCHD have?
Yeah, we're not getting into all those details. So the state plan is the template that we're utilizing to work for it. So we do this every year with flu and our flu mist and doing the school vaccination programs. So we're sending you to the state plan as your template of what we're expected to happen and what we're working off of. But again, details are changing so rapidly. We're not going to put all of the nuances out into the public until we're comfortable with where we are with those. And I know that's frustrating, I understand, but we don't want to put misinformation out that's going to change immediately.
Vincent's question was, he was asking if you could send the number of vaccines that we expect, which I think you just answered there with your previous.
Yeah, I still don't think it's helpful. So our bottom line right now is when we're not getting a different number daily or multiple times a day, we will start putting that information out. I can't stress how quickly this information is changing, and it's changing dramatically. So we want to be responsible and put the most factual information that we're going to be acting on into the public when we have it. And right now it's just changing too fast.
All right, please submit any additional questions. From Jeff with WATE, will we get updates about vaccine availability numbers once the shots start coming in?
We're gonna have to, I'm sure we will be talking about it in our media briefings. Like I said, Dina Mashburn, our director of nursing, will be doing these a lot more frequently moving forward. And we're gonna have to figure out what that's gonna look like. But again, there's so much variability right now, it's hard to figure out how we're gonna be able to provide information on that. But we absolutely will continue to keep you informed with Dina and others as we move forward.
All right, any other questions? From Katie with WBIR, it's cold, but if people want to dine outside, how can they do so safely? Are tents okay? Heaters?
So I think the safest thing to consider in that situation is making sure you're dining with those that live in your household. It's when we are integrating and mingling with people that we aren't around all the time in those close proximities, sitting at a table while we're eating, we're not having masks on, that's the highest risk. Outside of that, heaters are great. If you have tents that have air circulating within them, that's better than nothing. But if they're locked down tents, that's probably the same as being in a room. And that's probably one of the highest risk activities there is right now.
All right, any other questions? From Claire with WUOT, would it be possible to add staffing capacity to the hospitalization benchmark on KCHD's website? After Dr. Gray's report on Tuesday, it seems like this metric is equally as important as beds at this time.
Yeah, we can talk to the hospitals about that, but and I know this is frustrating because people want hard numbers for all of these things, but the hospital variability, there's so much fluctuation there that's probably even more of a moving target than what I'm telling you about our vaccine numbers at this point. That's really based on the acuity of the patients and where the patient needs are on how that staffing plays out. And it's very hard to do in a snippet of numbers. So I'm not sure if it's even possible. These are more discussions they're having on a day-to-day basis. And they're not, as far as I know, collecting overall numbers because they move and shuffle people constantly. And so I say all that to say I wouldn't hold my breath that we're going to be able to provide that information, but I will ask the question.
From Jeff with WATE, is it too early to know if KCHD has seen any improvement in public health metrics since the start of the case tracing / investigation prioritization structure?
Oh,
even anecdotally?
Yeah, no, I don't even have anecdotal at this point. It's going to be challenging. And what was the beginning of the question? Because I'm not sure if
is it too early to know if we've seen any improvement in public health metrics?
Okay.
Since that
yeah, I mean, we just did that again on Tuesday. And so definitely too early. And I'm not sure how we'll be able to tease that out as we move forward. This is really about being able to have the most impact, and we're going to have to figure out what that looks like.
From David Sykes with WVLT, how many cases were traced back to the gun show?
Well, we don't ever speak about specific cases or clusters. And I honestly don't have that information in front of me right now anyway. But as always, we're really talking about social interaction. So when you're spending a lot of time And the intent is to be socially interactive, where you're in close contact, you're talking, you're with people you're more comfortable with. I'm hopeful that at the gun show and at other events where it's more transactional, that people are wearing their mask and they're staying socially distanced and doing all the things to help prevent the spread of disease. So again, let's talk about the intent. We really want to discourage those close contact social interactions. We want you to still be social. We want you to stay connected, but again, be creative about how you can do that when you're not within 6 feet of each other doing it.
All right, I'm not seeing any other questions in the chat feature. If there's any last questions that need to come in, please go ahead and submit them. All right, not seeing any come in. So thank you all for your time today. We hope you have a good and safe weekend, and we'll be back with you on Tuesday.